Hello guys, I am Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about allergic rhinitis. Allergic rhinitis it is a type 1 hypersensitivity reaction mediated by IgE. Okay, so it is mainly due to the degranulation of mast cell. Okay, so it occurs in two phases, the early phase and the late phase. In early phase, there are some we'll see what happens: pollens, animal dander, dust, mites, debris, or any allergen, can be any kind. It is taken up by the dendritic cells. It activates Th2 cells, okay, and that activates interleukin 3 and 4. Interleukin 3 and 4, it acts on B lymphocytes and therefore producing Ig antibody producing plasma cells. And this Ig antibody producing plasma cells, they will produce basophils and mast cells. Okay, and these on re-exposure to allergens will produce histamine. Okay, and that will follow the reactions. Okay, and on re-exposure, these Th2 cells will produce cytokines too. In the late phase, these eosinophils, basophils, neutrophils, or lymphocytes, they release inflammatory substances. Okay, and that will cause inflammatory mucosal swelling. That leads to symptoms like nasal blockage or watery discharge. So, what is the etiology behind this? It can be inhalent, ingestant, or genetic predisposition. Allergic rhinitis can be seasonal only during a particular season when the pollens of plant are released, or it can be perennial, that symptoms present throughout the year. What are the symptoms of allergic rhinitis? So we have nasal symptoms, ocular symptoms, skin symptoms, and pulmonary symptoms. In nasal symptoms, we have nasal obstruction. So we have difficulty in breathing, itching in the nose. Okay, nasal obstruction, difficulty in breathing, itching in the nose, or along with the nose, we have itching in the eyes, pharynx, or palate, excessive sneezing, okay, or paroxysmal sneezing, and watery nose. So this is the nasal symptoms. In ocular symptoms, we have edema of the lids, congestion and cobblestone appearance of the conjunctiva, dark circles under the eyes called allergic shyness. Okay, so edema of the lids. In conjunctiva, we have cobblestone appearance or congestion and dark circles. In nasal signs, before that we'll see skin symptoms. In skin symptoms, we have itching or eczema. In pulmonary symptoms, we have asthma or bronchospasm. So what are the signs? Okay, now coming to nasal signs, we have salute sign. Okay, so there is formation of line over the dorsal of nose. This is known as Darier's line. Okay, if I try to draw a nose, so due to repeated itching, there is a Darier's line over the dorsal of the nose. This is called Darier's line. Otological sign, if it is due to, if it is serous otitis media or retracted tympanic membrane, we can see the air bubbles or air fluid level in the serous otitis media due to eustachian tube block, or you can see the features of ASM and CSM if there is complications. So how to diagnose allergic rhinitis? First, take the proper clinical history. If there is some family history, if it is diurnal variation, seasonal variation, what kind of allergens is are they like having problem with. After that, come to investigations. The first one is serum Ig. Serum Ig is elevated in case of allergic rhinitis. Second one is TLC and DLC. Peripheral eosinophilia is seen, but it is not a consistent finding. Then we have nasal smear. This shows large number of eosinophils. So eosinophils, like this is of allergic rhinitis. Then we can have skin test. Skin test, this help to identify the specific allergen. Okay, so there are different pricks. Okay, multiple pricks, and different allergens are introduced. And depending upon the wheel flare reaction, we can say if it is reactive to those allergens or not. But there is a risk of angioedema in skin prick test. So we have skin prick test in vivo, skin scratch test, and intradermal test. We also have radioallergosorbent test, RAST, that measures the specific IgE antibody concentration in patient's serum. So how we'll do that? We'll take a radio-labeled antigen. Like suppose there is a pollen, so radio-labeled pollen, radio-labeled dust, or radio-labeled dander, anything. And then we'll put drops of blood into that. If there is antigen-antibody reaction, there will be immunofluorescence confirming the type of allergen and the concentration of antibody. Coming to the treatment, the first thing is avoidance of allergen as much as possible. Then the treatment, that is pharmacological treatments. So what are the drugs that we can give? We can give antihistamines, we can give mast cell stabilizers, we can give anti-leukotrienes, we can give sympathomimetic drugs, oral or topical, and at the last we can give corticosteroids, inhalers, or like that. Then we can go for immunotherapy. Immunotherapy means we have to hyposensitize the patient. When it is used when other treatment fail to reduce the symptoms. What we'll do here, a known allergen is given in gradually increasing doses till the maintenance dose is reached. Okay, so we have to keep on giving them some small gradually increasing dose. Suppresses the formation of IgE, and it also increases the titer of IgE antibodies, thereby helping the patient. So immunotherapy can be subcutaneous immunotherapy or sublingual immunotherapy. Sublingual immunotherapy is preferred more. Okay. So coming to the complications of rhinitis. Okay. The treatment, we can avoid the allergen treatment, the pharmacological treatment, the drugs you can remember, and immunotherapy if those things are not working. So what are the complications of rhinitis? There is first one is recurrent sinusitis, nasal polyps, most common ethmoidal polyps. Okay, ethmoidal polyps. Ethmoidal polyps are due to rhinitis, like allergy. Then we have serous otitis media that we have told. While examining, we have to see ears also. Orthodontic problems and other ill effects of prolonged mouth breathing, especially in children. Okay, like you'll learn about adenoid facies, something like that. So orthodontic problems will also be there. Then bronchial asthma. Allergic rhinitis patients have 4 times more risk of developing bronchial asthma. So these are the complications of rhinitis. So we know the treatment part, we know the investigation part, we know the signs, we know the symptoms, and we know the pathophysiology behind the allergic rhinitis. Thank you so much.